Hello, my name is Patricia Rodriguez Lozano. I'm an assistant professor in the Division of Cardiology at the University of Virginia. I'm also the director of the Women Heart Program. My ultimate goal is to improve patient health as a clinician scientist. I aspire to make a meaningful contribution to science, be a leader in my field, and provide mentorship and guidance to other women scientists, especially those from underrepresented minorities. Our study focuses on a novel population and a novel therapy. We will examine the potential benefit of sodium glucose cotransporter 2 or SGLT2 inhibitors on coronary blood flow in women with coronary microvascular disease, that is the disease of the small coronary arteries, and that they don't have evidence of obstructive coronary artery disease using quantitative stress perfusion by cardiac magnetic resonance imaging. We are also funded for an ancillary study to test the hypothesis that SGLT2 inhibitors treatment will lead to reduced markers of systemic inflammation. So I wanted to highlight that only 38% of heart studies trial participants are women. And that is why we think that we don't know much about microvascular disease. That is a disease that is more prevalent in women. And as part of being the director of the Women Heart Program, there is a new initiative of the Cardiology Division is increase awareness in the community and improve education for women and healthcare providers of heart disease in women, but also for us, it's so important to expand the research specifically in women and in conditions that are more prevalent in women. And that is the reason that my research project is focused on this population and in this important condition for women, that is microvascular disease. Women under investigation for suspected myocardial ischemia are more likely to have non-obstructive coronary artery disease. And here is where microvascular disease is relevant. Today, there is a lack of appropriate design outcomes trial investigating therapeutic strategies targeting women with ischemia and non-obstructive coronary artery disease and persistent symptoms. Targeting symptomatic women with this entity is obviously an urgent need. This group of patients have sometimes disabled symptoms, and they also represent a problem in terms of healthcare costs, similar to subjects that have obstructive coronary artery disease. We think that the proposed investigation will significantly advance our understanding of mechanisms that are involved in microvascular disease, specifically also in women with non-obstructive coronary artery disease. And since there is a lack of evidence for treatment in this population, this proposal will fill an unmet need. And furthermore, our ancillary study will significantly advance our understanding of this drug, the SGLT2 inhibitors, and how can this drug be beneficial on treatment on microvascular disease.